The Orthopedic Department at Manipal Hospital, Bangalore is one of our hospital's oldest departments and has been serving the community right from the start of the hospital in 1991. We started off in a very small way, but today the department has grown to such an extent that we perform about 2,500 surgeries a year and see more than 32,000 outpatients a year. The orthopedic department consists of 10 orthopedic surgeons, of which 4 are senior orthopedic surgeons. We have 3 visiting consultants, and then we have specialists in spine surgery, pediatric orthopedic surgery and shoulder surgery. We can now cater to virtually all problems related to orthopedics, bones and joints, right from knee replacement services for advanced arthritis, both for primary situations where the patient has not had a knee replacement before, and revision situations where they have already had surgeries which have either not succeeded or the joints have worn out and it now needs a revision. Besides this, we have an advanced level 3 trauma service where we cater to various types of severely injured patients, multiple fracture patients in association with other injuries like head injuries and abdominal injuries. And we have a robust arthroscopy service which provides minimally invasive treatment for sports-related injuries in the younger patient population. Besides this, we offer the general orthopedic services and specialty services, as I mentioned, in spine, pediatric orthopedic services for our younger patient population, as well as special department for the shoulder. Over the years, we have been getting more and more complex surgeries to do because the patients have already been in several other hospitals, taken opinions, sometimes had treatments. Unfortunately, sometimes the treatments have not worked and they've come back to us to get the salvage procedures done and to help them come out of difficult situations. So today, we are in a situation where we can tackle complicated joint replacements, tackle neglected trauma victims, patients who have multiple ligament injuries which require keyhole surgeries of various degrees of complexity, and virtually you can say it's a one-stop shop for orthopedics. We have to keep ourselves and the department academically active and to maintain the quality. We have a teaching program and we are recognized by the National Board of Examinations as a center for DNB training. So we actually have orthopedic postgraduate students who come and train with us for 3 years and they train towards the DNB orthopedics course. We also run fellowship programs in both joint replacement and adult reconstruction services as well as for sports medicine. We work in association with several other departments of the hospital, particularly the accident and emergency department, the neurosurgery and plastic surgery departments, and sports medicine department, which is closely allied with orthopedics. Apart from this, of course, physical medicine and rehabilitation. So with all our associated services and the rest of the facilities available, we are able to provide the best possible skill in terms of the people available to treat musculoskeletal problems. Apart from this, we are backed up from the hospital side with excellent infrastructure, and we have 3 very well equipped orthopedic operation theatres which have the very best in terms of equipment. It has got very clean air with the highest standards of filters for making sure that the infection in the operating room is kept to the bare minimum on par with any international standards. We have various power assist tools to help us, high-tech image intensifier machines, and right from the operating theatre lights to the operating theatre tables and all ancillary services, we have not compromised in terms of the equipment that the department has. So thanks to the people, thanks to the equipment, thanks to the wonderful support from the other departments in the hospital and a very supportive administration, we are able to provide a comprehensive orthopedic services to all patients requiring musculoskeletal care right from birth to the age of 100 and 100 plus. Now, I would like to in particular talk about the treatment options we have for arthritis. So, arthritis, as you know, is a very common problem in India, and knee osteoarthritis is the commonest of it, followed by hip osteoarthritis and secondary types of arthritis, which is more common than hip osteoarthritis. So for these patients, we have treatments available right from the basic treatments, which would be modification of lifestyle, physiotherapy, exercise-based treatment, to, in some cases, they would be helped by arthroscopic treatment for arthritis, especially if they have acute pain due to meniscus injuries. Then we can offer them arthroscopic treatment, and this can be coupled on with injections in the joint to help lubricate the joint better. And in advanced cases, we can offer them total knee replacement services. Now, our total knee replacement surgeons in our group, we have excellent total knee replacement surgeons, and we offer minimally invasive surgeries, surgeries where the knee can flex to a great extent, that is high flexion type of knees, bone conservation surgeries where least amount of bone is sacrificed, especially in the time of primary knee replacement. We have knees which are specific for certain genders, like a knee which is specific for females, and certain types of latest materials which have the promise of longer lifespan. That is, the knee joint replacement that we put in is likely to last for longer time than the standard knee replacements. We also have customized knee replacements for very special situations where we can get instruments from the manufacturer specific for a particular patient, and we also have something known as computer navigated surgery where we would do that in special cases. So apart from this, as I already mentioned, we do get increasing number of cases where the patient has already undergone joint replacement elsewhere, maybe several years ago. Now the knee joint has worn out and that needs to be done again, and we have the facility to do that as well, supported by bone bank services which are outsourced, as well as tissue bank services which are also outsourced. We also have stem cell therapy available for early stages of disease where the arthritis is not so bad so as to require a joint replacement service. So this would be an entire spectrum of services that we have for arthritis.